Good morning. So nice to have you joining us for 3+U today. As always, we hope your day is a good one. And for those of you eager to embrace the fall weather soon to head our way, don't worry, it will get here. For those of you wanting to hold on to it just a little while longer, those days of summer to enjoy being outside and soaking up all the sun, you're going to get your wish too, because it'll stick around for a little while as well. It's perfect season here in the Tennessee Valley, which for all of you golfers out there, you know, is a dream come true. And that's how we're opening the show this morning, because we're so happy to have Kevin Lusk and Joel Henderson on the show. Joel represents Volunteers in Medicine. Kevin represents Project Access. Y'all are combining your efforts to bring the first called Golf for Good golf event to Brown Acres. Good to see you.
Good to see you too, Julie, and thank you so much for the opportunity to share, folks. You know, Volunteers in Medicine and Project Access have both had golf benefits in the past. Coming out of the pandemic, we said, why don't we do something collaborative, come together, and that's where Golf for Good was branded.
So I learned for the first time, because over the years I've talked with both you at Volunteers in Medicine, different members of that organization, and of course with the folks at Project Access. It wasn't until this morning, though, that I learned that each of you serves your own population, kind of.
Absolutely. Another opportunity to remind folks once again, what we do is we're primary care, and I refer to Project Access, which Kevin can talk about, as our cousin with specialty care. So each one of those providing that essential continuity of care for folks who are uninsured and want to have access to a medical home. Okay,
so Kevin, talk to me a little bit about Project Access's involvement in this, and then we'll get into the nitty-gritty about the fun of the golf event. But as a specialty care, is that a real gap maybe in
It's definitely
coverage?
a gap, and the reason why Project Access was founded back in 2004 is we have our partners like Volunteers in Medicine. Volunteers in Medicine serves as a primary healthcare clinic, but there was really nowhere to go where if someone came in and they had, for example, they were diagnosed with either some type of form of cancer or a broken bone or something like that, there was no place for them to go. They had to go find a doctor that may donate his time. But there was no really formal program in Hamilton County. So our president at the time of the Medical Society, Dr. Joe Kofer, decided we need to fix that problem, and he helped create Project Access, which is basically what we do is we receive referrals from our primary healthcare partners like Volunteers in Medicine. If someone needs a specialized, some type of specialized healthcare, they're referred to us, and what we do is we find a specialized physician to match up with that patient, and everything is donated from the hospital stay to procedures that may be done, x-rays, everything is taken care of. Everything's donated for the patient, and what we do is just help coordinate that to make things easier for the patient and the provider that's providing that care.
You know, I want to talk about the golf event, certainly that's why you're here, but I will stick on this one topic for a second. I was having a conversation just yesterday with some folks who are about my age, and we were talking about back in the day when we first had our first jobs. Might be the same way for you, Joel. Health insurance used to be totally covered for the employee. Remember those days?
Oh, back in the day.
You didn't pay anything if you were the employee. If you had a family, then you added that on. So I think it can be easy to not always realize how many people fall into that gap where they don't have any health insurance because they don't have the money to pay for it. Is that right?
That is, and what I see is a lot of folks coming in the hospitality industry, our service workers. Every time I see those help wanted signs, I think that could be, or possibly one of our patients, either trying to find that job, get healthy, get back employed, or keep that job. Because you think about with most part-time employment, there's no benefits, there's no insurance with that. And that's the type of adults that we see that we care for, making sure they come in, and also once they have the diagnosis, we have prescription assistance. So getting those medications, which is essential for that path of health and healing.
Okay, so let's talk about the golf event itself. And Kevin, you know what? I'm going to throw it to you first, because you were quick to say that yes, you're still taking teams. You want people to come out September 16th, right?
Yes,
to Brown Acres.
right.
But y'all have got an auction where the golf fun continues.
We do, and you know, the great thing about this is most people come to golf tournaments. There's no, they love golf. So what we've done is we've tailored an auction specifically for those that love golf and want to do that in their spare time. So we've found several golf courses in Chattanooga, but also within a couple hours drive of Chattanooga, in Atlanta and Birmingham and Knoxville and Nashville, that have donated packages for folks that want to travel outside of Chattanooga for a day, make a day trip, and just play golf at some courses, some of the greatest courses in our area at the Southeast that they may not be able to play before. And some of them include meal packages with it, and some of it's just a round of golf with a cart. But there's something for everybody, and it's going to be a great time, and we're looking forward to be able to offer that to our golfers.
Okay, I don't know how much of a golfer either one of you is. I am not a golfer, so I can get myself into trouble, but I can't go beyond that. Teams of 4?
Teams of 4 and also individual players.
And individual players. And what's the cost, do you know, to sign up for a team?
Yes.
You can look at your team sheet. I'm a big believer in those.
So we have 4 teams still available. Trying to fill the afternoon. That's always time to come out and play, enjoy that sunshine.
Okay.
$500. Individuals $150. It's fun, but it helped fund, once again, both of our collaborative health missions.
And you know what? You were talking, Kevin was, about the great courses around the area. Maybe most people know this, but Brown Acres, people love to play at Brown Acres. It's a public course, yes, but people say it's a great course.
We enjoy it every day. Where Volunteers in Medicine is, that's our backyard. We're right there by Eastgate, by Brown Acres. It's our wonderful neighbor and a course to see and play on.
With the monies that are raised from the auction and then the golf teams, what are y'all hoping to do with the money? Are you splitting it? Are you putting it toward one joint effort?
50-50.
50-50. Do you have anything in mind at Volunteers in Medicine?
Well, it immediately helps our Project Access and Volunteers in Medicine patients. Once again, we share those patients for that continuity of care, so our neighbors will receive that care.
And Kevin, do y'all have anything specific or just the general fund?
Well, we'll continue our work, but we've also expanded. We've been in Hamilton County for the last 20 years. We're expanding into Bradley County and throughout the region in Southeast Tennessee, so we'll use that to help us expand our mission to those other counties that are underserved.
Well, I'm learning more and more about the importance of these groups all the time, so thank you both for sharing your time with us this morning. Is there a deadline? You just only have 4 spots left, is that right? For the golf, you have 4 teams left?
We have about actually 8 or 10 for the afternoon still, and
Okay.
I think 2 in the morning, so don't delay, register today.
Hey, it'll go fast, so you don't want to be the last one to click on the Yes, I'm in button. So it's the Golf for Good, the first annual, September 16th. The fun begins at 8, runs until 8 that evening. Say hello to fall or hold on to summer, whichever you choose. And the website to go to sign up is?
Sure, they can go to either one. So vim-chat.org or also Kevin's site. Kevin?
Chatmd.org.
Easy to do. Thank you both.
Thank you.
2 Sonic Chop House cheeseburgers coming up.
Adding the crispy onions.
Spreading the Chop House aioli.
Sonic Chop House Cheeseburger, ready for pickup.
Remodeling your shower or bath? Well, right now, West Shore Home is offering its biggest discounts of the season on all projects with this limited time offer. Get free installation on all new shower or bath projects. Plus, when you call right now, get 18 months of no payments and no interest financing. Choose from deep soaker tubs, easy step-in showers, and make it your own with customizable wall styles and accessories. Call the number on your screen right now to get your shower bath project started and to take advantage of these amazing savings.
Spectrum presents Stream Home Makeover with JoJo.
We transform the Joneses' home, upgrading their entertainment experience with the best TV and internet services from Spectrum. Let's go! With Spectrum TV, you get your favorite channels and streaming apps, plus tons of on-demand.
Switch to Spectrum TV and Internet for only $49.99 a month each. Now with even faster speeds of 300 megabits per second. Call 1-844-480-4713.
Ready for more? Take a look. With